All right, I'm going to demonstrate how to do a cruciate suture pattern. Cruciates can be used as a part of a simple interrupted series with more linear skin incisions like you would see on a midline abdominal approach, or you can use them, and they're commonly used in tie-over bandages in an ER setting, or you can use them for just irregularly shaped wounds, sort of like this one, or maybe even smaller ones like this. It just depends on the situation and the patient you have in front of you. But I'm going to show you how to do one. I'm going to talk you through how to do one, and I'm going to do one without talking you through so you can see both and know how to do it. To start out with, you're going to start on the far side of your incision, maybe about 1 to 2 millimeters away from the edge of the far side. And you can go through both sides of the incision with a single bite, sort of like that. Go ahead and pull your needle through, regrip for your next pass through the skin. But before you bite through the skin again, you're going to want to go ahead and pull your suture through right now. It'll make your job a lot easier. And as you're pulling this suture through, you want to make sure you don't pull it way out here outside your sterile field. You want to keep it within your sterile field for obvious reasons. Okay, and then make sure you leave yourself a decent tail. It's going to make your job a lot easier in a couple seconds as well. All right. And then you can leave your suture within your sterile field, sort of like that. Doesn't look pretty, but it's functional. And then you can do your next pass through the skin, just right next to your first one. Same thing. All right, and then instead of regripping, I'm not going to grip my needle drivers again. I'm going to actually stow my thumb forceps in my needle in my non-dominant hand. And again, I'm going to pull that suture all the way through. And I want the skin edges to be opposed, so I'm going to pull pretty tightly right there to make sure they're opposed. And you're going to do 4 throws like you normally would with any kind of suture. But instead of all of them being super tight, your first 2 are actually going to be pretty loose. The thing about cruciates is you usually use them on skin incisions, and skin loves to swell. So you want to leave room for that swelling to occur. So you see there's still room underneath my suture for my needle drivers to go through. And that's when you know there's enough room right there. So those are my first 2. For your second 2, you can do it like you normally would. Pull tight, make sure the knot's really good and stable. Like always, you're going to pull equally on both sides. Keep your hands at a level plane. Okay, and you can go ahead and cut your tails. And you don't want to cut your tails too short. The thing about skin incisions is you just take those sutures out later on, and if they're too short, it's going to be hard for you to take them out later on. So keep them kind of decent. And there you have it. That's a cruciate.